Presently, I'm in the Environmental Health Institute, overseeing research work related to environmental epidemiology and toxicology. And this evening, I'm going to be sharing with you a little bit about the dengue outbreak early warning system in Singapore. And this is the very brief agenda for the next 20 minutes or so. So I'll be sharing a little bit about the role of surveillance, introducing you to Singapore's dengue surveillance system, what is the utility of dengue outbreak early warning systems, and then I will finish off with a very, very quick summary of the key points that I shared this evening. Now, what is the purpose of surveillance? And I particularly like this definition from the WHO from 2012. So let's read it. Public health surveillance is the continuous, systematic collection, analysis, and interpretation of health-related data needed for the planning, implementation, and evaluation of public health practice. Now, that is such a mouthful. Even I have some difficulty processing that, but let's just break it down. So what does continuous mean? It refers to a continuous period. So you keep doing it. And surveillance is also about systematic collection of data, meaning we don't randomly or haphazardly collect information. We collect it systematically. And then when we've collected it, we analyze it, and then we interpret it. And why do we do these things? Because this is needed for advanced planning, for the implementation of policy and practice, and also for the evaluation of public health practice. So with the surveillance function, you can do a number of things. For example, you can detect where are the high-risk population areas. You can develop study questions to understand what are the risk factors for disease transmission. You can detect changes in the patterns of disease, inform policy and practice, even assess the impact of vector control interventions. And a lot of you might be interested in this as well. Obviously, it would enable you to manage disease outbreaks. Now, public health surveillance isn't something that's new. It's a concept that was introduced many, many years ago. So, for example, in London, they had bills of mortality where they recorded the causes of death. And then in Germany, the surveillance system was put up to assess what were the impacts of water and sewage treatment on child and maternal health. Then in the US, in the 1700s, there was a surveillance system put up because there was increased infections for yellow fever, smallpox, and cholera. Then in England and Wales, some of you may recognize this, John Snow. He is known to be the father of epidemiology in certain circles, and he carried out the investigation of the Broad Street pump that enabled the authorities to determine what was the cause of cholera back in London. And then, of course, in the 1900s, in the US, Langmuir created the National System of Disease Reporting, and WHO also established a global public health surveillance program. I've listed some of these articles below, and then you can read them in your own spare time. What are the essential components of surveillance? Now, surveillance doesn't just function on its own. So we know that data collection is a very, very important component. And we've also heard that data analysis and interpretation is required to make sense of the situation. But a third component that's often forgotten in some circumstances is the dissemination of findings. So after you've collected the data, you've made sense of it, you then have to disseminate it in order to inform action, either by the stakeholders, by other regulatory agencies, or even to initiate community action. Now, a little bit about dengue's strategy in Singapore in this particular slide. So as you can see, we aim to keep the dengue incidence low. And we do this by reducing the mosquito population and also interrupting the dengue transmission cycle. Now, there are 4 key pillars, as you can see, and these are supported by regulatory controls as well as scientific research to provide the evidence for some of the vector control practices and approaches that we adopt. Now I'll focus on the other three pillars for now. So one of the pillars is preventive control, where our officers carry out risk-based search and destroy operations, and we collaborate with different stakeholders. When dengue transmission intensifies, then we too have to intensify our search and destroy operations. We carry out vector control measures to address adult mosquito populations, and we have to increase the motivation of community and stakeholders in removing stagnant water that can breed mosquitoes. And lastly, of course, we have to enhance public communications and advocacy by carrying out national level initiatives and stakeholder specific engagement. Now, what I really wanted to focus on for this particular slide is the first pillar, which is real-time surveillance. Now, real-time surveillance in Singapore can be broken down into four key components. We collect information on dengue cases, the virus, the vector, which is the Aedes mosquito, as well as monitoring weather patterns. Now, in this particular figure, we can see the trend of dengue cases by epidemiological week. So the 52 weeks over here. So we can plot these collected information over a weekly time scale. So you can see that I've displayed the data from 2013 for selected years up to 2019. Now, what you've noticed is that there is a peak in the middle of the year for certain years. So for 2013, 14, and 2019, but there is also lull years in 2017 and 2018. So the collection of case data enables us to understand the seasonality of dengue transmission so that it enables us to prepare ahead of time resources or plans that would help us to address these peaks in the middle of the year. Now, so this is the identified peak season for Singapore. And I'll go on to the next slide and perhaps ask a couple of questions, and you can type your responses in the chat. Now, we also have more than 60 weather monitoring stations placed across the Singapore island, and they collect information like ambient air temperature, cumulative rainfall, relative humidity. Now, anyone can respond in the chat. What do you observe about the pattern of temperature in Singapore within the year? So if you look at the first figure on top, that shows the mean temperature by epidemiological week within the year. What do you notice about that? And how do you relate that to this particular figure where you see the peak in dengue transmission in the middle of the year? Anyone? Yep. So Zahid said favorable temperature for mosquito to breed. Yes, positively related. That's right. So you can see that the rise in ambient air temperature is similar to the pattern for the rise in dengue cases in the middle of the year. 20, 30 degree favorable. Yep, all good. So then let's refer to the figure below, and that's cumulative rainfall. So what can we tell about rainfall in Singapore? So you can see over here, rainfall is kind of, more or less the same throughout the year, but there's a kind of a slight rise towards the end of the year. So I'm just going to have this brief discussion just for a minute or two. How does temperature influence dengue cases? So we saw over here that temperature, okay, so rainfall Miriam is saying that rainfall is not really related to cases. Yep, there's no obvious relationship over there. So how do you explain the relationship between temperature and cases in the middle of the year? So what what is what is the mechanism through which temperature influences dengue infections? Anyone? Okay, so with higher temperature, we expect the extrinsic incubation period to decrease, so mosquitoes can become infective with the dengue virus more quickly. And so that could lead to an increase in infections. Yep, decreased incubation period. Okay, Zahid, you said higher temperatures increase Aedes longevity. So you said, I think what Zahid you're trying to say is that at higher temperatures, the Aedes mosquito lives longer, so they can infect more people. Okay, temperature is proportional to mosquitoes. Okay, so at hotter, in warmer temperatures, I think what Mino is saying is that people could be outdoors more often, and then maybe they're more exposed to mosquito bites. Okay, okay, yeah. So I'm going to just move on to the next slide. So one of the other components of the surveillance system in Singapore is the virus surveillance. So approximately 10 to about 20% of dengue positive clinical samples are serotyped. And from that, we're able to determine quite broadly what are the circulating strains of dengue in Singapore at any one point in time. So this particular figure basically shows the fractions of each of the four dengue serotypes, 1 to 4, and it's plotted together with the black solid line, which represents the incidence of dengue in Singapore. So the red refers to dengue 1, the blue refers to dengue 2. And I've deliberately plotted it according to the cycle, a 9-year cycle, 2004 to 2012. So what you've noticed over here is when there was a switch from dengue 1 to the blue in dengue 2, that was associated with a rise in dengue cases. And dengue 2 remained for a large part of this period the dominant dengue serotype. And we did not observe any other dengue outbreaks. There were some, the usual middle of the year, but nowhere compared to what we saw in 2007 and 2005. Now, if you look at the figure below, again from the end of 2012, where dengue 2 was the leading serotype, there was a switch to dengue 1 in 2013, and that was also associated with a longer outbreak period, one in 2013 and one in 2014. And then, of course, there was another spike here. Where you can see that dengue 2 surpassed dengue 1 as the leading serotype, and it was accompanied by an outbreak. So if you look at the first 6 years of this 9-year cycle from 2004 to 2019, they are quite similar in terms of the predominance of dengue 1 and when the outbreaks occurred, when there was a switch to dengue 2. Now, the situation was a little bit different when we compared the last 3 years of that cycle. So as you can see in 2010 to 2012, when dengue 2 remained the predominant serotype, there was hardly any outbreaks. There's a little bit of a rise in 2011, but not to the extent of 2007 and 2005. But what we observe in the last 2 years is despite dengue 2 being the dominant serotype in Singapore, there was this big outbreak in 2019, and there was a historically large outbreak in Singapore in 2020. What do you notice about the pattern in these 3 years, 2018 to 2020, in comparison with that from 2009 to 2011? So in this particular period, we can see that dengue 2 continues to be a leader for the serotypes, which is pretty much the case in 2018 and 2019. But what else do you notice about this period from 2018 to 2020? Anyone? Yeah, Salahuddin. Yes, that's right. So you've noticed that there was an emergence of dengue 3, which is the green fraction of this figure. So you can see that dengue 3, it has existed in Singapore for the past 15 years or so. We see bits of it here and there. And then in 2016 and 17, we saw it growing in proportion, but then it died out. And then in the last 2 years, we've seen a lot more of dengue 3. So the emergence of dengue 3 could have contributed to these outbreaks that we've noticed in 2019 and 2020. So could Budin has said, yes, D3 emergence. Zahid, yes, you're right. Good control on D1 and D2. They've been alternating, but somehow D3 crept up. And that was what we observed in 2019 and 2020. So other than case surveillance, which is the solid line in black, having information on the circulating viruses allows planners and policymakers to understand what might be causing or associated with some of these spikes that we've observed. So yes, Salahuddin said, yes, we're very, very low immunity to DEN 3. And we have better immunity to dengue 1 and 2 because of previous exposure. That's right. I'm going to quickly move on to the next slide. Now, other than case surveillance, virus surveillance, it's also important to have entomological surveillance. Basically, without the mosquito, no transmission can occur. Now, in many settings, the collection, the discovery of larval habitats helps to provide an indication of potential transmission in a particular locale. Now, the challenge with larval habitats is that it takes at least a week for the larvae to develop into a mosquito, and then another couple of days before the mosquito can become infective. So other than monitoring larval habitats in Singapore, in 2017, Singapore rolled out a very extensive island-wide entomological surveillance program. So you can see at the bottom, these are gravitraps. So these are black cylinders. They're placed in residential estates all across the island, and that's depicted with the green shaded areas. These gravitraps, what they do is they trap mosquitoes on a sticky inner surface over here. So any female mosquitoes can then lay their eggs, which will drop through a wire mesh. These eggs may drop into the water. The larvae may emerge as adults, but they cannot escape because of the mesh. And part of this sticky lining also prevents any adults from escaping if they land on it. So it does have a somewhat adulticiding effect. Now, with all these gravitraps, we collect information from them on a fortnightly basis. So we're able to determine what are the entomological activity levels within the year. This is data collected from all the gravitraps around Singapore from 2007 to the end of last year. So in the first figure right above with the solid red line, you can see the trend of trapped Aedes aegypti adults in Singapore. So I'm going to use this term GAI as the short form. It stands for Gravitrap Aedes aegypti Index. It measures the average number of female Aedes aegypti mosquitoes caught per trap that's laid out. So when you collect information like that, so you see some cyclical patterns, possibly some ups and some downs, and then we can take this data and we can break it down into different components. So the first component that we can break it down into is the long-term trend, depicted by this solid green line in the second figure. And you can kind of see that there is sort of an upward trend, sort of an upward trend. And those of you who are slightly more discerning, you may have also noticed that there seems to be a sinusoidal pattern even in the long-term trend. So you can see over here, possibly suggesting that the trend of female Aedes aegypti mosquitoes also has a multi-year pattern to it. But we've only started this program since the end of 2017, and we haven't had enough data in order to establish that. But what is quite clear to us is really in this third figure, as you can see in the solid line in blue. So you can see a certain kind of a seasonal pattern in their GAI. Anyone, what do you notice about the seasonal pattern? So these are the years. So these are the start of the years. What do you notice about the seasonal pattern, and how can you relate that to what we saw in terms of the seasonal pattern of dengue infections in Singapore? So this would be the middle of the year without the date label. This would be the middle of the year. What do you notice? So I think the first thing you would notice about the seasonal pattern is there appears to be two peaks within a year. There's a slightly higher peak. Yep, that's right, Salahuddin. There's a slightly higher peak in the middle of the year. It coincides with the rise in temperature. It also nearly coincides with the peak transmission period that we observed. And we also see that there is a second peak towards the end of the year, but the seasonal pattern for the rise in cases towards the end of the year was less obvious in the reported dengue infections that we saw. So this also, collection of entomological data through your surveillance program, also enables you to understand what might be driving dengue infections at different points in the year. Now I'm going to quickly talk about the concept of the outbreak early warning system. And I think one of the most simplest ways to talk about this is to ask a question. So this research question can be phrased as follows. So is the number of reported dengue infections this week, which is N, this week is, let's say it's week 0, is it associated with a change in the parameter N weeks ago? So this is N weeks ago up to 9 weeks ago. So this change in parameter could be any weather factor. It could be temperature, it could be rainfall, and then entomological could be either larval indices or it could be adult entomological indices and other kinds of epidemiological factors. So we can ask this question, and using statistical modeling, we can determine the relationship between changes in that parameter X weeks ago and how it relates to cases this week. And of course, we can do it for any number of weeks. We can do it 9 weeks ago, we compute one for 7 weeks ago, and so on and so forth. So in reality, what you would do is to compute the relationships between these across all the weeks in order to determine what works best in terms of the early warning system. Now, of course, you could also compute what is the relationship between, say, a parameter last week and the number of infections this week. Now, this is a question, it's an important question. So if you were in charge of plans, what do you hope that your early warning system would provide you with? Would you hope that it would be a stronger relationship, closer to the present week, or further away from the present week? Anyone?
Joel, you have 5 minutes left, please.
Okay, I'm going to speed up. So for this particular slide, I think the takeaway message is if you can find relations between the parameter of interest and the cases in the present week, the further the lag, the better. If the lag structure is very, very close by, you're not likely to be able to mount whatever measures you have in mind in order to address dengue infections in the present week. Yeah, that's right. Okay, I will skip over this slide. So in Singapore, what we've done is, based on the surveillance program that we've put in place, we were able to collect information on dengue infections, entomological indices, weather, and using modeling to account for long-term trend and seasonality. So we were able to develop a dengue forecast model, and the earliest case use was in 2013. So imagine that you were at E-week 9 or 10 in the early part of 2013, and we did a projection, and that's depicted by the red dashed line. So we predicted that, and the bright red solid line was the observed line, although it was not a complete match. But basically, this forecast model enabled us to prepare for what was back then a historical outbreak for Singapore. So surveillance data can help you with the aid of data analytics to build an early warning system for dengue outbreaks. Now, other than the slightly longer term forecast, we also make use of the Gravitrap information in order to provide short-term predictions on anticipated dengue transmission at the local level. So what we can see over here is using the reference of areas with less than 10 mosquitoes per 100 Gravitraps. When the GAI levels are between 0.1 to 0.15, you can see that there's an increased odds of intensified dengue transmission occurring. And that's similar to the level when GAI is between 0.15 and 0.2. But when GAI levels exceed 0.2, then the odds of cluster formation increases to about 4 compared to the levels below 0.1. And these are using entomological indices computed in the past 4 weeks prior to the present week. So if you have this information, you can also use this in order to prioritize where vector control resources need to be allocated to. So I mentioned it at the beginning that it's not sufficient to just collect and process the data. We also need to make it available in order to galvanize community action. So over here, in an earlier presentation, you might have heard that information on areas where there is intensified transmission is made public. So there's a website right at the bottom of the slide. Everyone can access it to know whether the areas in which they live in or are in close proximity to have ongoing dengue transmission. And over here, information on the GAI is also made available to members of the public. So depicted by the purple areas, these are areas with high Aedes aegypti activity. And we believe that by making this surveillance data available to members of the public, it informs their action to remove stagnant water that can breed mosquitoes, and also to take self-protection measures, for example, applying insect repellent. Now, other than doing the forecast, we also plan ahead of time what are some of the dengue risk areas of concern that we would allocate scarce resources to. So using machine learning and the data gained from our surveillance program, we're able to classify different areas in Singapore according to the risk areas. So the darker areas represent those with higher risk, and the green areas represent those with lowest risk. And through this machine learning, we were able to determine an 86% agreement between what we observed in terms of the dengue burden and the predicted dengue risk ranks. Now I'm going to skip over this slide because of the limited time, but I think on your own, these are some questions that you could think about. So if you knew that the dengue incidence was going to rise at some point in time, what would be the utility of those disease forecasts in terms of the different areas? So in terms of healthcare systems, what would you do in terms of preparing your diagnostics, chemicals? How would that inform the number of people or inspectors that you would need to get ready? Different logistics, different public comms plans, and how you would mobilize the community. What plans do you have, and so on and so forth. So very quickly, in summary, surveillance is absolutely essential for disease control. It does enable early warning. Data analytics itself is not an end, but it can greatly empower your surveillance function. And surveillance, lastly, is a means to an end. Remember that surveillance data, you have to collect it, you have to analyze it, and then you have to push it out so that it informs action. Okay, with that, I think I've come to the end of my presentation. Thank you very much for paying attention.